'Tis the season for the flu. Amid the thick of the holidays and in the peak of the Burr months, flu and RSV cases are rising nationally. On Guam, the island's flu season typically begins earlier than the U.S. mainland. Public Health Chief Medical Officer Dr. Bob Leon Guerrero says in August, cases of RSV, COVID-19, and influenza were most prominent. While the island is close to the tail end of the flu season, he cautions residents not to let their guard down and to be cautious of other respiratory viruses alongside influenza type A and B.
This time of the year, we are seeing probably some other respiratory viruses. We have three, I think 2 or 3 kids in the ICU that are negative for RSV, COVID, and influenza, but they're having some sort of respiratory virus that's causing them to have some issues.
Dr. Leon Guerrero stressing the same advice given during the COVID-19 pandemic.
During the height of the COVID, people were really paying attention. They were wearing their masks, washing their hands, and other respiratory viruses like influenza, RSV, were almost non-existent in the first 2-3 years of COVID. Now people are more inclined to not wear their masks, not wash their hands, not social distance, start smoking more.
Additionally, flu shots for anyone 6 months and older is recommended.
So see your doctor, try to get tested to see if you have influenza, COVID, or RSV.
As for RSV, he says the virus tends to severely impact infants and the elderly, adding vaccinations to aid the most vulnerable populations are underway.
We're at the tail end, but to help, because there's going to be kids coming in from college, spreading it. So to the ones that didn't get infected, there's a good chance you can get it. So the best way to avoid is, again, try to get the vaccines if available. And also, if you're sick or somebody is sick, ask them to wear a mask to help decrease the risk of spread, and then wash hands.
An important message to help us all enjoy the holiday season. Destiny Cruz, KUAM News.